Okay. The career I've chosen is that of a social worker. And I have a friend who is a social worker. She started out with CPS, and that became way too stressful for her dealing with the situations that she had to deal with. So she got a different job, and it was a social worker inside a hospital. And although I wasn't able to get back with her and her with me in order to interview her for this, I do know that she's happier where she is in the hospital. And I found a position of an opening for the same kind of job that she does. And it's the only difference is this hospital is a Catholic health ministry hospital. So it has about the same amount of beds and the same amount of workload, but they have a different, their ministry and their mission is, they say they exist to extend the healthy ministry of Jesus Christ. So I thought that was wonderful. That would probably be a very good environment to work under. And so the typical stressors are for social workers is there's a little pay for the amount of work that you have to do. And your clients are in crisis. Even when you're working in the hospital, just it might not seem like such a crisis if you are, helping a new mother understand, what to do for her new baby and that sort of thing. But a lot of your other patients would be in crisis. So the time pressure is also a stressor. Inadequate resources, ambiguous conflicting roles, lack of feedback, and a demand of profession and family. And then there's always the changing external factors. There's always things are changing. The typical benefits for this Christus Spohn health system that I searched on is that they do have benefits, and I believe my friend does too. She has medical health coverage, prescription drug plan, dental coverage, vision coverage, long-term disability, group term life, accidental death, and dismemberment. So that is something that helps take a lot of the stress away. The common task for the job is they're responsible for meeting the patient's need for the whole continuum of care at the hospital and through to the discharge planning process. They direct access to the appropriate community and adjunct resources that foster quality of life, interview patients and their family members, their support system to obtain an age-specific psychosocial assessment, assist patients and families in adjustments to illness and disabilities, and resolve personal, financial, and environmental difficulties which interfere with the care management process. Provides crisis intervention, individual and family therapy where a skilled social worker judgment is required. So you do have to have a couple years experience in this position. Provide discharge arrangements beginning upon patient's admission. You attend and actively participate in the patient care rounds, and you work with the healthcare team to collaborate and formulate appropriate and realistic discharge plans. You assess the psychological needs of the family members and support systems that may interfere with optimizing the patient's care management. Demonstrates awareness of the importance of addressing patients' quality of life by maintaining current and up-to-date information of community resources, and refers patients to those community resources which will enhance patients' life. Provides resource referral for counseling services and other recognized psychosocial therapies, child abuse referrals, adult protective services referrals, guardianship petitions, and psychiatric petitions. Initiates referrals and appears in court as subpoenaed. Demonstrates competence to perform assigned patient care responsibilities in a manner that meets the age-specific and development needs of the patient served by the department. Provides referral to spiritual care and assist in crisis intervention to patients and their family members involved in emergency trauma, deaths, loss of home, family violence. And I don't think that this maybe is every hospital, but because this one is a Catholic hospital, then they do provide referral for the spiritual care of the person also. They assess high-risk patients who exhibit behaviors that are maladaptive to the adjustment of the illness and or disability. So those are the common job tasks. It takes a 4-year degree. The starting salary is $37,458. Experience ranging up to $48,000 to $58,000. Employment of social workers of all types is expected to increase faster than the average for all occupations through 2020, with the greatest growth expected for healthcare social workers and the least for child, family, and school social workers. So it sounds like it would be a great career if you can handle the stressors. All right, thank you very much.